I personally can't attend, unfortunately, because my diary on the date of the conference is booked up, but I have arranged to meet with one of their keynote speakers after the event, where I'm going to meet them in an evening to actually talk through. I think that personally there's quite a few things the department can be working with Quing on. We engage with various third sector organisations throughout a year, and I think Quing around mental health and well-being is one that we can do things with.
In a world where we're trying to save money all the time, and of course the department knows how easy it is to overspend or have projected overspends, and you've just had the new budget, of course, is this a time where you should be actively looking at other third-party programmes, initiatives going on?
Well, the department is actively looking. We are looking to engage with all sorts of third sector organisations, not just in the mental health sphere, but across all the services the department engages with, and looking at services where we can commission services from other bodies. Quing is one of those where I think, particularly, like I say, around the mental health, the well-being, and also self-help, which Quing does as well. I think there is things to be looked at there to see what opportunities there are available for partnership.
One of the programmes they're looking at this year is regarding a organisation in Slough, which have just picked up an award and have been in Westminster in Parliament picking up that award for their mental health work. It's a 12-month programme and it costs around the region of £240,000. Now, they're not saying we want government to fund this for the Isle of Man, but it could be funded by government. It could be funded from someone else privately or independently outside of government. Are those the kind of things that you would be willing to take part in?
Well, they're the things we want to engage on to actually see what we can do. When it comes to mental health, you've got to have programmes that are pretty much tailor-made. You can't just necessarily pick something up from one area and plonk it into another, because as Quing themselves actually say, it's very important that it's tailored to the needs and demands of the people on the ground.
Quing do say this is absolutely perfect for the island, though.
Well, they believe so, but we need to engage with them to actually see what aspects we feel should be done. As I've said before, the department is moving services onto a commission basis. So what we will be doing going forward, particularly once Manx Care and the new World of Health is in place, services would be commissioned out to the third sector. It won't just be a case of giving someone a grant or paying for one thing or one thing alone. It will actually be on a basis of delivery of a particular service.
To find out if it is appropriate for the Isle of Man, maybe not taking up and plonketing exactly, but if it can be moved slightly, it can be adapted to work well on the island. Isn't that something someone from the department should be going to find out, going to the conference that Quing hold?
Well, my understanding is there's conversations that have already taken place with Quing over various different things around mental health and well-being. It's not just about attending a conference. Like I say, I was personally invited to the conference, but as I immediately went back and said, unfortunately, my diary was already booked out for that particular day. I'm not aware if anyone else from the department has been invited along. There may well be someone who is attending, but the important thing is the chat that we have with third sector organisations such as Quing about how we engage and see if there is any services that need to be commissioned that they can actually do in a much better space than we can.